I was diagnosed with atherosclerosis. I don't have the typical risk factors. I don't smoke. I don't have diabetes. The doctor thinks it's genetic. And it's just in my legs. My heart checked out fine. I had angioplasties in both legs last fall. It's plaque. There's no calcium. I don't have resting pain or wounds. So I had been, the blockages have returned in my thighs. So 3 months later, the blockages where they opened them up returned. And so I've been building up collaterals and walking 2 miles a day. And I'm feeling pretty good. Yeah, I'm feeling pretty good. So I have two questions because my doctor says she has no one like me in her practice. Like I'm kind of a conundrum. So for a patient like me, is a blood thinner for the rest of my life necessary? And number two, if I can maintain this lifestyle by not intervening for 2 or 5 or 10 years, is it going to make it harder to intervene on me in the future?
Yeah, those are great questions. And I think the easiest way to answer that would be to kind of start from the beginning and explain what the disease process is rather than jumping in the middle of the river, so to speak. Arteries in the body get clogged up over time, the way the plumbing in your house gets clogged up. And that's the simplest analogy I can use. And you may not do anything wrong. That just may be partly how your genes are put together, and that stuff is going to happen. And so it doesn't mean you're a bad person. It doesn't mean that you smoked. It doesn't mean that you have diabetes or anything, but it's kind of part of the aging process, the same way we get joints that ache and, our hair turns gray and falls out and all those other things. It's kind of part of the aging process. All right. So there's really only two reasons to treat people as far as interventions go. One is to make you feel better, and two is to make you live longer. And so if we can't make you feel better, we can't make you live longer, it's not really worth doing an intervention every other day to try and keep an artery open per se. Now, if you're having a lot of symptoms, that's a reason to try and fix things. But having said that, no matter what procedure or intervention you have, whether it's a balloon or stent or bypass or whatnot, those are only plumbing tools. The same way as if I come and unclog your kitchen sink in your house, it doesn't mean it's not going to clog up tomorrow or 5 years from now. And so the medications that you end up being on to keep your cholesterol super low or to keep your blood a little bit thin, those are extremely important. Keep your blood pressure, adequately low, and if you have diabetes or anything like that, those are the underlying problems that cause this. And so treating those with medications for the rest of your life is extremely important, because you're not going to die because your leg hurts. You're going to die from a heart attack or a stroke down the road. I mean, that's the reality of it. 40% of the United States population dies from heart disease. And so even if I fix your leg today, that doesn't mean you're not going to have a heart attack tomorrow. And so the medications, the blood thinners, the cholesterol medicine, the blood pressure, the diabetes, all that stuff is extremely, extremely important to treat the underlying disease process. P.A.D. is not like taking out your appendix. It's not like a one and done. It's not like you're cured, or take out your gallbladder and it's over. It's a disease process. Just like high blood pressure is a disease process. We can control it with medications, but you're not really ever cured of it per se. So even if I open up your artery today, you're still not cured of the disease process to put that there in the first place, if that makes sense. So
yes, yeah, thank you.
So having your arteries blocked is not the end of the world. It's really the symptoms that they cause, and then whether you're having symptoms or not. And if you're in a limb threatening situation where you have such critical reduction in blood flow that your leg is having a problem, that's a different issue. But if you're able to walk 2 miles a day and you feel good, I absolutely would not do an intervention on you, but I would highly recommend that you continue all your medications forever to prevent you from having more problems down the road. I hope that answered your question.
That does. Thank you. And just to be clear, if my ABIs continue and my toe blood pressures continue to be above what's considered severe, and I can continue to walk, if I could do this for 5 years, 10 years, that's okay to have a plugged up thigh?
I haven't had hair for 20, 30 years, and I still get around every day. Okay. So your body adapts to things, and your body will adapt to the blockages, and you'll develop collateral flow and stuff. And so it's not a problem. And if you can live the rest of your life like you are right now, I wouldn't get overly worried about it. Okay. Just keep
Okay.
doing the right thing. If down the road, if you start feeling like you're having symptoms, then you can address it. I'm not saying that you may not need another procedure at some point down the road, but I'm saying if you feel fine and you're able to do your normal daily activities, then that's really what really matters. I have patients that their biggest activity of the day is walking from the couch to the refrigerator, and I have some patients that want to run marathons. So it's really what your lifestyle is and what you want to accomplish during the day. And if you can do that, then I wouldn't worry about whether you need a procedure or not.
And I think that,
Okay.
one of the questions I get asked all the time, isn't it easier for a doctor, or doesn't it make sense for a doctor to treat, let's say, and I'm going to use more clinical terminology than they do, but a short focal lesion versus waiting, and then what are the chances of it growing into a long calcified occlusion that becomes the Achilles heel, like in the SFA?
Yeah, that's more a process of that's more a factor of the disease process per se. And so I wouldn't dwell on the technicalities of that kind of stuff. I mean, those are more things that doctors would worry about. I mean, if you have a 1 inch occlusion, or if you have a 10-inch occlusion, it's I wouldn't focus on that number. That's what the doctor worries about when they try and fix it. But I wouldn't lose sleep over whether you have a 1-inch blockage or a 10-inch blockage. That really is irrelevant to you.
I love this because he's an advanced skilled doctor, and literally he treats the most complex occlusions, complex blockages. So it doesn't even phase him. It doesn't matter. I don't care whether it's short or long or whatever. I'll get in there and I'll just do it.
Yeah.
I'll just get her done.
Yeah.
Oh, that's
much,
fantastic. Yeah. That gives me a lot of reassurance, because on my left eye, it is, it's it's
yeah. I mean, people get focused on things that are not relevant to their own care. So I wouldn't worry if it's like I said, whether it's a 1-inch blockage or a 10-inch blockage. I mean, if it's the entirety of your leg and you have no blood flow in your entire leg, that's a whole nother issue. If you got a blockage that's 4 or 5 feet long, that's a whole different argument. But
no,
if you're just worried about a segmental blockage, I wouldn't get too excited about that.
But we always suggest, Darlene, that it's
Yes.
always good to get a second opinion. Make sure that you
Yes.
do have a couple people in your back pocket so that you can
I have
always
two-
weigh if
I-
something needs.
Yeah, I've got
You do.
2 doctors. Thank you. Yeah, thank you so
That
much. I
is
appreciate it.
that is